Booyah!
What's going on, ladies and gentlemen? Welcome back to The Fringe. Danielle Smith has been a hot button issue lately in Alberta, and one that I've mostly been very vocal on in my opinions. And one of the things I want to talk about today is her plans for Alberta Health Services. Now, we've seen Danielle coming in strong when it came to her stance on COOF mandates and the behavior of those like Dr. Dina Hinshaw by firing her outside of the provincial, AHS coordinator job that she had. But furthermore, we've seen Danielle also doing some questionable things that I've called out in the past, hiring Alison Redford as an advisor, and now making a move with AHS that really has me asking questions. Now, I do understand, if you're unaware of what's going on, I will explain it, but if you are in Alberta and are probably very hard pressed on the issue, I do understand some people's concerns when it comes to what is happening with AHS and removing hospitals from their jurisdiction. But now, what happens in the aftermath, and is this the right move for Danielle to make? Well, I'm pleased to announce Danielle will be joining me September 14th here on the channel for an interview, and I'm looking forward to sitting down and talking with her about this not only the statements she made about growing Alberta, but also this move with AHS. I think that's going to be something great to discuss with her during that interview. And while we're doing that, if you guys have any questions you would like for me to ask Danielle while I have her on the show, make sure to put them in the comments down below and leave a like on the video. It helps the channel. It helps get this video out there for the YouTube censors. Very much appreciated. Let's get on to what's happening with Danielle Smith. Now, she's recently made a poll. It says here that she reveals plans to transfer some Alberta hospitals away from Alberta Health Services. Now, when I first heard about this, I said, this is fantastic, because if you look at QP and if you look at the unions that are involved in Alberta Health Services, it's all just a money game. It has nothing to do with actual health care. But as you go further down the iceberg on this one, some questions do come to mind. At a UCP Town Hall event last week in Drayton Valley, Premier Danielle Smith revealed the next phase of her government's restructuring of healthcare in Alberta, including plans to remove Alberta Health Services as the operator of some hospitals and turn facilities over to other operators like Catholic health care provider Covenant Health. The Alberta government is currently setting up a structure where the government retains ownership of facilities and leases them to AHS and is prepared to also take away their authority to operate hospitals as well, Smith said in the town hall on August 17th. Because if our operator isn't performing the services we need them to, we're going to take the hospitals back, said Smith. So again, what I can get from that statement is that it's kind of akin to what Pierre poilievre has said he wants to do with home building, that if you want your federal money, municipalities are going to have to meet targets. They're going to have to meet demand. I'm assuming what Danielle is talking about here is if you're not providing the services, if you're keeping people on long wait lists, if you're not providing the adequate services you're supposed to, we're going to step in and we're going to take over. It says here, the next phase is to see how many of those hospitals that AHS currently operates that we can retake ownership over. We can't do it for all of them, she states. Smith said that the strategy will improve the delivery of healthcare and help eliminate service disruptions in rural hospitals by introducing two incentives into the existing system: competition and fear. When you're dealing with a monopoly, which it is, and they believe that they can deliver any type of care and there are no consequences, they're going to continue to deliver bad service, and competition is one option. That's why we're offering chartered surgical centers and why we're offering Covenant, Smith said. But the other fear is of having it taken away. That is going to be a very powerful competitive incentive for the managers to say, oh my goodness, if we continue to deliver terrible care in Drayton Valley, then somebody else is going to be chosen for the operator. So again, incentive to actually provide the care that they're being told to uphold. In La Crête, Smith said the government is already moving the hospital authority over to Covenant Health. She told the town hall that Covenant Health has never closed down rural hospitals, and it may well be that we just need different operators in smaller communities so that we can get back to delivering that level of care. These changes will be slow, Smith said, and the government will campaign to get authority from Albertans to go forward and make these changes. Lorian Hardcastle, associate professor of the faculty of law of the Cummings School of Medicine at the University of Calgary, said changing hospital administrators would come with substantial investments of time and money, and that it doesn't address key issues within the healthcare system which cause temporary closures. It seems to be more of what we've already seen, which is a change for the sake of change and not the change with a view to improving access or improving quality, she said. AHS has been running these facilities for a long time and has that expertise. No, they don't. They drop the ball at every corner. For Covenant to take over those facilities, it's going to take time, it's going to take money, and it's not clear what the payoff is. There may also be some providers who aren't interested in continuing to work for a facility if Covenant takes it over. And so it's not clear this is going to help recruitment, retention, and it might make it worse. So what she's essentially saying there is because of union workers in QP, they may shuffle some money and shuffle some interests around to make it look as though Danielle has been doing a terrible job. Hardcastle said that the claim in the Covenant Health would be better suited to run rural hospitals is unfounded, and that the Premier needs to provide a rationale for why changing operators would have an effect on the number of rural doctors in the community and their ability to do work. So you're seeing a lot of arguing going back and forth. But again, this is politics. It has nothing to do with the actual care. These people are not concerned with the care that's coming into hospitals. Now, the question that I have is whether or not this is a bold move to make, because essentially you're taking hospitals from a crown corporation and giving it to another corporation to run, rather than really finding what's going to suit Albertans best when it comes to their needs by, again, focusing on retention, focusing on actual medical care professionals, and better working conditions, I guess, to bring in new professionals. I know right now, in order to find a doctor in Alberta, it is a challenge for sure. You have many doctors leaving the provinces. You have many people under AHS's guises saying that they're being told to essentially work for free, that they can't afford to be doctors in this province. And it definitely provides a lack of care, a lack of resources. And I think that those are the things we have to tackle if we're going to make things better. Many people have concerns when it comes to, we'll say, childbirth rights, that because it's a Catholic board that's taking over these hospitals, that somehow is going to mean people are denied certain treatments. I don't know if that's the case. I'm not going to weigh in on those things because I'm not a woman. I've never had to deal with those choices. However, what I will say is that I think that, again, what's happened with the media is you've seen folks like Naheed Nenshit come in and say that, you know, this is terrible, it's not the right thing to do, that we should continue funneling billions and billions and billions of dollars into AHS, when obviously that's not the answer either. So it's really just politics at the end of the day, folks, and people stretching something to look bad. Although I've seen such a pushback, I'll say, from more conservative supporting citizens against Danielle's decision to do this. And again, it is something that I will try to bring up with her when I have her here on the show on the 14th. I'm looking forward to that interview, and hopefully we can get the answers as to why. But how do you guys feel about what's happening with AHS and Danielle with these hospitals? Let me know your comments down below. If it's your first time here, make sure to hit that subscribe button. Hopefully it's earned your subscription. Also, make sure, again, leave a thumbs up and a comment on the way out. It helps tell YouTube that, hey, this video is worth checking out. It's good to watch, and it's got some good information in it. And the guy talking isn't that bad to look at either. So make sure to get that in there. And make sure to also join me live here on the channel each and every Friday night for Friday Night Fringe, my weekly live streaming show, where myself, my wife, Mrs. Fringe, join us on the channel, and we chat about everything going on in the week in politics, as well as some back and forth within the community, and some quirky stories and fun times. It's always a good time to hang around with everybody. We have a good time in those streams, and I look forward to seeing each and every one of you there. I hope you guys enjoyed this video and have a great rest of your day. I'll catch you on the next one.